The first pitch hit on down in the left field.
Whoa, whoa, whoa. Let's pause that for now. I don't want to force you to watch a video of me falling and injuring myself, but if you are interested in seeing it, I will put the full clip at the end of this English lesson. Well, I thought I would do an English lesson about injuries. I'm a bit of an expert on injuries right now. As most of you know, I fell in a baseball game. So I thought the first lesson back after taking a bit of a break to heal should be a lesson about injuries. So welcome to this English lesson about injuries. So there's actually two verbs that you need to know for this English lesson about injuries. The first is to injure, and the second is to hurt. But when we talk about ourselves, we usually use the verb get with these two verbs. So you might say something like this. If you play baseball, you're going to get injured. If you play baseball, you're going to get hurt. That's the most common way to talk about it. If you do something crazy like go mountain biking and you go fast down a hill, you might get injured or you might get hurt. Sometimes when you get injured or when you get hurt, it's kind of your own fault. And a lot of times we'll actually add myself or yourself to the phrase. When I played baseball the other day, I injured myself. When I played baseball the other day, I hurt myself. This means that another person didn't do it to me. I ran, my leg, my muscle stopped working, and I fell down. So I injured myself. I hurt myself. So quite often when you're the cause of your own injury, you will add myself or yourself to the phrase. I injured myself or I hurt myself. When we're talking about the exact body part that has an injury though, we just use the verb to injure and the verb to hurt by itself. I could say this, I hurt my collarbone, I hurt my shoulder, I hurt my ribs. A lot of stuff hurts here. I also injured my hamstring. I injured my leg. So when you are describing where you have an injury, you just use the verb by itself. I hurt my shoulder. I hurt my leg. So when you hurt yourself, you have a decision to make, or maybe the people around you have a decision to make. They need to decide whether to take you to the hospital or if they need to call an ambulance. If the injury is minor, let's say I just twisted my ankle, or maybe I bumped my head and I can walk and I can talk, I might just ask someone to take me to the hospital. But if the injury is severe, or if there's multiple injuries, or if you can't really stand up or walk, which was my situation, someone will need to call an ambulance. An ambulance is, of course, a vehicle that comes with two people inside who know how to take care of you. Here we call them paramedics. So the ambulance will come. They might even have the siren on. In my case, they didn't. And two paramedics will put you in the ambulance and then they'll take you to the hospital. So what are you going to do? You can either have someone take you to the hospital or you can call an ambulance. So once they put me in the ambulance, they took me to the hospital and they took me specifically to the emergency room. At a hospital, the emergency room, or we sometimes just call it emergency, they took me to emergency. This is the place in the hospital where people go when they need help immediately. When they are injured or when they are really, really sick, they go to the emergency room or they go to emergency so that a doctor can see them as fast as possible. So the ambulance scooped me up and they took me to the emergency room. I'm not going to give you a giant list of injuries, but I'll talk about two types of injuries. One is to break a bone and the other is to pull a muscle. These are probably the two most common sports injuries. If you're playing a baseball game or a football game, there's a good chance you will pull a muscle. This means that the muscle may be stretched a bit too much and all of a sudden it's very, very painful. And when you break a bone, it means the bone inside your body is broken. That's not a very nice feeling. So in my case, I broke my collarbone. This is the bone that's broken. And I pulled a muscle in my leg. I actually tore the muscle in my leg, which is a little bit more severe than just pulling a muscle. So there are a number of kinds of injuries. The two that I think are most common when playing sports is to break a bone or to pull a muscle. When you are injured, immediately the area where you have the injury will start to swell. When I broke my collarbone, this started to swell. When I tore my hamstring, my leg started to swell. And the solution for that is to put ice on it. they gave me an ice pack to put on both areas to help with the pain and to help with the swelling. So swelling is when an area of your body gets bigger, probably because lots of blood is going there, and because that is where the injury is, your body's already trying to fix it, so it will get bigger. It's not very nice. It will also be very, very painful. And an ice pack is a bag of ice cubes, or just a special pack with gel in it that's frozen that you can put on the area where you have the injury to help with the pain and mostly to help with the swelling. And of course, if you have an injury, you're going to have pain. And if you have pain, you might want painkillers. Painkillers are a type of medicine that make pain kind of go away, or it makes it so you don't feel the pain. For me, they just gave me two kinds of painkillers. They gave me ibuprofen, which we call Advil here in North America quite often. That's the name brand. And they gave me acetaminophen. I think I said that right, which we call Tylenol here in North America. So I was on two kinds of painkillers. They didn't give me anything stronger, which I was happy about. I don't like really strong painkillers. And I'm actually, sorry, there's a little mosquito here. I'm actually still taking a little bit of Tylenol once a day or so when things still hurt a little bit. So when you're in pain, they'll give you painkillers and it will help you manage the pain. So when you arrive at an emergency room, the doctors and nurses need to diagnose you to see what is wrong with you. They need to look at all of the medical evidence to decide how they are going to treat you. They need to diagnose you to see what the problem is. When the doctor was diagnosing me, the first thing he did was he watched the video of me falling and then decided that I needed a CT scan because it looked like I bumped my head. He decided that I needed blood work. They needed to take blood to make sure that my blood was the way it's supposed to be. They took my pulse a few times to make sure that my heart was functioning right. They also gave me, I forget what it's called, an EKG to make sure my heart was working the way it's supposed to. And then lastly, I had some x-rays done. They took an x-ray of my collarbone. There's a picture right here for you. And they also took an x-ray of my leg just to make sure it was just a hamstring tear or a hamstring pull instead of something worse like a broken bone. So when a doctor needs to figure out what's wrong with someone, they need to diagnose them. And that's what they did to diagnose me. And then the doctor decided how they were going to treat me for what was wrong. So my treatment, or how the doctor decided to treat me, was pretty simple. I was in a wheelchair for about an hour while they decided that I just needed crutches. It wasn't so bad that I needed a wheelchair. They decided that I needed a sling for my arm. So I needed to wear a sling for 2 to 3 weeks so that I wouldn't move my shoulder so it could start to heal. And that was it. They didn't even give me a prescription for stronger painkillers. They just told me to take Advil and Tylenol like I mentioned earlier. So that was the diagnosis: broken collarbone, torn hamstring. Treatment: don't move the arm for 2 to 3 weeks. And then for the leg, it was just don't do anything that hurts. So I could walk. I could use the crutches to get to the car to go home from the hospital. And since then, I've just been walking a little bit every day to keep things moving. So that was the treatment. So I guess the opposite of to injure yourself or to hurt yourself is to heal. When you are injured, you need time to heal. You need time to recover. Those are the two verbs that we use. So if you saw me, you might say, "Hey Bob, how long is it going to take for you to heal? How long is it going to take for you to recover?" And I would then say this: my recovery time is about 6 to 8 weeks if everything goes well. My recovery time is a bit longer than I expected. So the two verbs that you use after an injury, you ask, how long is it going to take to heal? How long is it going to take to recover? Or you can simply say, what is your recovery time? So during my recovery time, I have to go to what's called physiotherapy. I have to go to a place where they'll help me move my arm in a way where it doesn't get injured again, but where I can build strength so I can use it again. They'll help me with my leg as well to start to stretch out the muscle and help me regain the abilities that I had before. So physiotherapy, I think it's also called physical therapy, is a place where you go after you've been injured so that your muscles and joints and bones all work the way they're supposed to again. Well, hey, thank you so much for watching this English lesson about injuries. I hope you learned some new words and phrases that you can use in your next English conversation. And I haven't forgotten, the clip of me running and falling is coming up shortly. But before you do that, why don't you leave a comment below? Give me a like if this video helped you learn a bit more English. Share this video with a friend. Consider becoming a member. Membership has its privileges. If you want to learn more about that, there is a join button below. But without further ado, here's the clip of Bob the Canadian hitting a beautiful line drive, running as fast as lightning, and then falling and doing a faceplant.
Okay, Fritz, head on down in the left field. Take your time, and they get the out at first. Fritz over first base.